about health-related topics, particularly about topics related to you and right now to the pandemic. And I do this for a couple of reasons. One, to get information because I'm very curious, but also to give you information that hopefully you can go away with that'll help you, your families, your loved ones, your community stay as healthy as possible and get through this pandemic as soon as possible. And today, very happy to have with me Dr. Bob Wachter. He is a professor and chair of the Department of Medicine at the University of California. And he is also the person who coined the phrase hospitalist back in 1996, which is now the fastest growing profession in medicine. And it's a very well needed one, especially right now in the midst of a pandemic. But Bob, thank you for being here with us.
It's great to be with you, John. Thanks.
And what we want to talk about today is kind of the state of where we are right now. And particularly, we're hearing this word a lot. People talking about the endemic virus, the endemic stage, the endemic phase versus the pandemic. But describe what do we mean when we say endemic virus? What does that mean?
Yeah, I think it's one of those inkblot tests because it has about 100 different meanings. I think what people generally mean by it is that the pandemic has gotten to a point where the number of cases are stable, hospitals aren't being stressed, it's no longer the lead story on the news. I've said it sort of snarkily to some reporters who've asked me when will we be in the endemic stage? And I said, when you stop calling me. So, I mean, the true meaning is that it's no longer a global phenomenon. It's no longer expanding and surging in different parts of the world. But I think we all, it's become shorthand for no longer in the predicament we've been for the last couple of years, stable cases, no longer the dominant issue in our life. And we've gone back to a version of normal living, maybe not exactly 2019 normal, but a lot closer than we've been for the last 2 years.
Endemic doesn't mean safe, correct?
Well, endemic doesn't mean that the virus is gone. That's clear. And I think it is now quite clear that we are going to be living with SARS-CoV-2, a version of COVID, forever. And so it does not mean that the threat of getting sick with this virus has gone to zero. It means that the threat has receded. It means that we have tools to deal with it and manage it. But it does not mean that there are no people getting sick with COVID, and it does not mean there are no people dying of it as we go forward.
And what I've heard some experts talk about, and see if you agree, is they say we're in the endemic phase, or it's an endemic virus at this point, when it's manageable and fairly predictable, not completely, but somewhat predictable. Do you agree?
Well, certainly manageable in that it is, it's around, but we have a set of tools to both prevent it and then deal with it if we get it. Predictable, I guess I have a little bit of quibble with that because I think that we are going to be entering, if we haven't already entered, what we would all call an endemic phase, low levels of virus, restrictions receding in most places, relatively low level of cases. But there will almost certainly be surges that might be mini surges and might be larger than that. But in terms of predictability, I can sort of tell you that they're likely to happen in the winter, but I can't tell you for sure there will or will not be one in the summer in Florida. So predictability meaning, I think predictability meaning we're unlikely to have a major surge of the kind we just had last month or the kind we had with Delta. But even that is unpredictable, meaning if there's a new variant, we'll be back in the soup again, or at least potentially. So more predictable than it's been, highly unlikely that we're going to have major surges that bring us back to where we've been the last couple of years. But in terms of the when and where and how big and all that kind of stuff, I wouldn't call it super predictable.
And when you compare it to other viruses that are endemic viruses, people often tout the flu. Are there other viruses you'd compare it to? When it gets to
flu is the main. I think flu is the main one that is very familiar to people. We still have low levels of measles and some of the childhood viruses, but for the most part, as an adult doctor, the only really endemic virus that I think of is the flu, which predictably will hit us every winter. And all of us have woken up to the fact that flu kills 30 to 50,000 Americans a year. It's not a nothing. And we're in a very interesting phase with COVID where up until fairly recently, the idea that COVID was, quote, like the flu became politicized like everything else and became sort of, and to me was wrong. I mean, there was no question that COVID was not like the flu. And part of the challenge now is for people who have had 3 vaccine shots, it actually is like the flu. It's a level of threat that's not that dissimilar to the flu. So everyone kind of wrapping their head around what does that mean? And as we think about it being like the flu, there's a certain narrative, which is we go about our lives every winter with a threat of the flu. We don't change our lives for it. And then some, a reasonable retort to that is maybe we should have been wearing masks for the flu the last several years, particularly if you were at higher risk.
And you bring up a good point, because it's the first time I've heard it said that way, but it makes a lot of sense that if you're fully boosted, if you've had your 3 shots and you're protected, then it brings the threat level down to essentially the flu threat level, which, we have the vaccine for that obviously as well. Not completely eliminated, but still there and much better if you're boosted.
Yeah, I think that there are a couple of little caveats with it that are worth paying attention to. One is in some ways a good potential future for us, which is the threat now to me, and I'm hoping you, if we've gotten our 3 shots, is not that dissimilar to the flu in terms of the short-term outcomes. What are the chances that we're going to get really sick, need to go to the hospital, and die? It may get lower than that, assuming there's no nastier variant on the horizon, as some of the medications become more generally available. The main one, to my mind, is this Pfizer drug called Paxlovid, which in the clinical trials lowered the hospitalization rates and the death rates by 90%. The problem is, for now, it's in such short supply that if I got sick today, I wouldn't have access to it. It really is, we are reserving, at least at UCSF, to people who are at super high risk and immunocompromised, and people who are unvaccinated. But as that drug becomes in more general supply, it may lower the risk even below that of the flu, maybe by next winter. On the other hand, when I think of the flu and I think of is COVID like it, I tend to be thinking in terms of the acute risk. And what are the chances you're going to get really sick, go to the hospital, go to the ICU, and die? There's this other thing with COVID, and that is long COVID, which is, I think there's still some uncertainty around it, but it's worth respecting that uncertainty. We know that about probably 5% of fully vaccinated people will develop symptoms that last for longer than a month or 2. And, it turns out flu can do that too, but we don't think about that. The thing about COVID that does cross my mind, a study came out 2 weeks ago that looked at people a year after their COVID infections, and the rates of cardiac complications, heart attacks, strokes, was significantly higher a year out. I don't know what that means. I don't know what to make of it, but it is another reason that even if the risk of getting sick and dying of acute COVID is not different than the flu, I still respect COVID a little bit more, and I'm probably still going to be a little more careful about it, in large part because I don't know about what the long-term consequences of COVID are going to be.
And Bob, let me ask you this, because, when we talk about the pandemic, we talk about the pandemic by its definition, which means it's essentially everywhere in the globe. It's an epidemic of global proportions. Can we be in an endemic phase here in the US if there still is a pandemic globally?
Yeah, I mean, that's part of what gets funky with the nomenclature. Are we really, can you really have a local endemic when there is a pandemic? And I think the bottom line is, in some ways, why I don't love the term endemic, because in many ways it's confusing. I think the answer is yes, we can be in a state in San Francisco or Colorado or New York or in Florida where the level of virus is low, the hospitalizations are low, the risk of getting sick is quite low, there's still virus around, and you can go back to pretty close to normal life. You may choose to continue to wear masks. You may choose to be very careful if you're at particularly high risk, but you've had the opportunity to be vaccinated. That can be our world while the virus is still raging in Africa or in India, or you name the place. The risk of those things, A, there's a humanitarian risk, which is we feel terrible when people are getting sick anywhere. But B is, as long as that happens, there is, of course, the risk that there will be a new variant, and the variant, as we've seen, can boomerang and end up in our world fairly quickly, which means the fact that it's an endemic today is absolutely no guarantee that a year from now we won't be facing a worse variant, in which case we could find ourselves in a bad position once again.
Now, you're in San Francisco, and California just released their endemic plan. And this is their plan looking forward to that endemic phase of the virus. And like you mentioned, I think part of the thought process is, okay, we could still have a pandemic, but here in the US, at least we can, do some planning to treat it like it's an endemic phase as things progressively get better, but understanding that things could roll back a little bit too. What are your thoughts on that endemic plan?
I thought it was wise. I think it sort of does something that's quite important, which is to shift our mindset to say we're going to be living with this virus probably forever. We've got a lot of tools that we can apply that we didn't have a couple of years ago: vaccinations, boosting, medications, testing, including home testing. We understand masking better, and when it's appropriate, when it's not, we understand the role of ventilation. We need to be applying those things for a long game here rather than a short game. And the other thing the plan did that I think is quite wise is you can look through that plan and you will not find the words mission accomplished. Anyway, I mean, it basically says that it is appropriate to be less careful than we've had to be for the last 2 years, because the current situation, it's sunny outside from the COVID world. It's time for us to let our guard down and begin living and enjoying life more. But unfortunately, there's absolutely no guarantee that that will be our future state. So we have to remain vigilant. And a big part of the plan is, what does the surveillance look like? What do we do to see that there's a new variant or that cases are going up? Is that wastewater? Is that testing? Is that hospitalizations? And it turns out it's a little bit of all of the above. But it really makes a very clear point that here's where we are now. Our brains have been so pickled in anxiety for 2 years that it's actually pretty tough to sort of think about, okay, I can kind of go back to a little bit a version of normal. But we have to do that at the same time we're saying this is absolutely no guarantee that there won't be another surge in the future. There won't be a nastier variant in the future, and we have to prepare ourselves for that possibility.
Now, do you see the future, and by future, I mean over the next couple of years, Bob, of us having to kind of keep these on hand, keep our masks on hand? There could be potential surges, and whatever entity, local entity, state, federal government saying, putting out recommendations, hey, it's time to go ahead and put masks back on for a couple of weeks, maybe go to remote schools, remote work, that type of thing?
First of all, I will carry my mask with me for the foreseeable future. And because, even in a world where you don't have to mask, if I get into a space where it's super close in and I don't know, if my spidey sense here says this is a place that I'm just where I see somebody coughing and sneezing across the way, I'll probably pull my mask back on. I'll keep wearing it when I go shopping because I don't need to be unmasked for half an hour. I'm not talking to anybody in the Safeway. I will keep wearing it on airplanes, even if they don't make me. So a point I've tried to make, which is even if you don't have to wear a mask, we now have in some ways, a more challenging set of decisions, which is, should you? And I'd say if you're at particularly high risk, or you find yourself in a setting that you think is a particularly high risk setting, it's reasonable to take it out. But the broader point you're making, John, I think is right, which is I think we're going to be in a world for the next blank number of months where we've been given permission to go back to something resembling normal. But it is entirely possible that we will hear next November that cases are beginning to surge again, and maybe certain parts of the country. The wastewater is showing that the level of virus has gone up. And it may begin with a strong recommendation that everybody wears masks, or it may begin with, now is the time that we're going to roll out another booster for people. I think the one thing you said, I'm not sure will happen. I think there's so much pressure not to close the schools down that, and I think as people look at the last couple of years, people think that was maybe a policy error, how vigorously we close the schools down, because we really learned the consequences of remote education. It just didn't work very well. So I think the schools will probably be the last thing that closes. But I do think that we have to be in a mode where it's possible that we hear cases are beginning to surge. It's time to go back to a much more restrictive form of living for, let's see, a month or 2 months, in the hope that there'll be a surge and it'll go away again.
And I described it on TV earlier today because the question was, are we at the end? And I said, we're still in the forest, but the trees are starting to thin out a little bit. And that doesn't mean that all of a sudden they're not going to thicken up again. The example I want to give you, Bob, is England. Right now, they've dropped essentially all restrictions, all recommendations. They're basically just saying, hey, let's go back to life as normal. They did that before and it bit them. They ended up having big surges because of that. Are they doing it too prematurely right now?
I think it's a little premature. I mean, everybody is so antsy and so tired of this thing that
They are.
the problem is the virus doesn't care that we're tired. And so I think the problem is you have wishful thinking and fatigue blending with policy. And I think it is absolutely reasonable to look at the case curves coming down and saying we're almost at a place where the cases are low enough, the level of virus in our community is low enough that we can begin at least giving permission to people to go back to normal. But saying to people, as California has done, we still highly recommend that you wear a good mask in an indoor setting. You don't have to anymore if you're fully vaccinated, but we think it's a good idea. I think to basically pull all restrictions and say, go back to normal, they may get away with it. And the reason they might get away with it is A, this virus is milder. B, so many people have immunity from either vaccination or infection that there will be a period of time where even if people are not being careful, there's a lot of resistance to infection in the community. So it's a little bit of a bet, and it's possible they'll get away with it and they'll feel good that they got back to normal a month or two before we did. But it is a bet, and it's possible they'll lose it, in which case they'll see a surge of cases and they'll regret having pulled the plug on restrictions as early as they did.
And you mentioned the virus being more mild. We have the subvariant of Omicron, the BA2, is popping up in different areas and become dominant in some areas, not here in the US yet. Is that a concern that these cases could go back up? I know in some areas they've plateaued a little bit. I'm not sure there's been big surges because of it, but what's your thinking on that?
Yeah, so far, not a big deal. So far, it does look like it's a little bit more infectious than the original Omicron, but not fundamental. I don't think it fundamentally changes the game, and it certainly does not look like it's more severe, and it does not look like it's evading the immune system. The thing about BA2 that I think is most striking to me is every time anybody says it can't possibly be more infectious than Omicron, all of a sudden this one comes along and says, you're wrong, it can be, it is.
So I think we kind of said that about Delta too.
Exactly. It can't be worse than Delta. Look how bad Delta is. And then Omicron comes about. So, we just have to have a really healthy respect for this virus's ability to shapeshift. And anytime you hear yourself saying or hear someone saying it can't be any worse than blank, that that's just wrong because it has been. And I think it should give us a healthy respect for the possibility there'll be a new variant that comes along at some point that actually is worse than Omicron. But I think BA2 in and of itself may extend the tail of the curve a little bit longer. We'll have more cases a little bit later than we would have otherwise. Otherwise, I don't see it as a big game changer.
And I want to ask you two more final questions. The last one's going to be about, your message for people that can give them hope moving forward here, especially now that we're at this stage of the pandemic. But the one before that I want to ask is about second boosters, because I know you've been tweeting out about that. Where do we stand with that right now?
Yeah, it's interesting because the evidence is really mixed, and it all comes from Israel. So it's sort of two major studies came out from Israel. The first one, first of all, what is clear is the effectiveness of your vaccine. Your booster does begin to wane at 4 months. I'm about 5 months out, so I'm reading this literature very, very avidly. The second fact, though, is very important, which is your risk of getting infected isn't only related to your own immunity, it's related to how much virus there is in the community. So even though my immunity has waned from my second booster, I still don't think I'm at super high risk because there's not that much virus around here in San Francisco. If we were surging, I think the pressure to get another booster would be greater because the exposure to the virus would be much greater. The literature from Israel is indeterminate at this point. There was one study that showed that the second booster lowered the probability of an infection and a severe infection by about 3 times. So significant improvement. And another study showed it did bump up your level of antibodies, but didn't seem to make a difference in the cases. So I think at this point, because we're at a lull in Omicron and we're going down, I don't think there's pressure for us to get that second booster out. I think we can afford to wait a month or so until the studies clear themselves up. And when they clear themselves up, it'll go one way or the other. It will either be It's clear that it does decrease the risk of an infection and a severe infection, and therefore people, particularly at high risk, should get another booster, or that may show that it just raises your antibodies but doesn't really do much to your level of infection, in which case I probably won't get one because I assume it will wane too. I'd rather wait until there's a greater threat if we see another surge. And the thing is, your booster begins kicking in about a week. So if it turns out we're beginning to see beginnings of a surge and the evidence is clear that a second booster helps, I think we all will have time to go ahead and boost particularly high risk people. That might not happen till the fall.
That's a great way to look at it. And final question, like I promised, what's your message for people moving forward here?
Well, I think we are in a new phase, and probably the most benign phase that I can remember in the last couple of years. Now, I wish I could say that's the way it's going to be forever. I can't, and nobody can. But I think we can say it now. And a point that has been made, and I think is really quite important, is that COVID has been so politicized. There are certain parts of the political spectrum that have emphasized how bad it is. I mean, we're closing in on 1 million deaths of Americans. It has been an absolutely horrible, tragic thing. On the other hand, there are other parts of the political spectrum, and where I live in San Francisco is a place that's taken COVID very seriously, had very severe restrictions. And I think a lot of people are having trouble coming out of it. Their brains have been so much in sort of the anxiety mode, oh my God, I've got to be super careful, that I think it's important to really look truly at the situation now. And when you look at the situation now, it looks pretty good. And all evidence is it will continue to look good, at least for the next few months. So I think this is a time where it is worth trying to go back to normal, to get together with friends and family, to travel, keep the mask with you, wear it if you're particularly high risk or you're going into a particularly high risk setting, wear it, but it is no longer a time where you have to feel like you're hiding under the kitchen table. Because at some point, this may be about as good as it gets over the next several years. So I think it's important for people to enjoy it.
Well, Bob, thank you very much. This has been fantastic, and just minutes and minutes of information here. I appreciate you being here with us and you sharing all the information and giving us a good idea of what's going to go on moving forward. And hopefully, again, we don't hit another one of those variants that just pushes us back again. But like you mentioned, this is a tricky virus and it's fooled us more than once. So
exactly,
keep our fingers crossed and keep everything in place here as best we can to keep things under control. But thank you very much. Appreciate it. I hope you have a wonderful rest of your week.
You as well, Don. Thanks so much.
This is Dr. Bob Wachter again. He's a professor and chair of the Department of Medicine at the University of California, and obviously knows a lot about this. So hopefully we'll have you back at some point.
Love to. Thanks for having me.
Bye.